Hello, it's Alexa here from KelownaNow. I am thrilled. I get to sit down with Steven Hopp, owner of Rutland Medical Pharmacy, and we are starting a new series.
Absolutely.
And I am so passionate about health and wellness, and so I think this is going to be really exciting. And I think there's actually so much that you can share with the audience and people and educate them. And there's more to pharmacy than people think. So actually, this is our column is going to be Beyond the Counter. And our first topic is what your pharmacist can actually help with. So I think that's perfect right there. We were talking a couple of weeks ago and I was like, well, yeah, I didn't know this. This could have helped me. This could have helped me. So maybe we kick off first question. You can introduce yourself more if you would like, or we can kick off to the next question.
Sure. That was a great introduction. My name's Steven. People who don't know me, I am the owner. I'm a pharmacist, pharmacy manager of Rutland Medical Pharmacy. So we're a small, locally owned independent pharmacy in the Rutland area. I like to call us Rutland's best kept pharmacy secret, or Kelowna's best kept pharmacy secret, because we're not that visible, but once people find us, they usually love us. So just to toot my own horn. But yeah, this is wonderful. I appreciate the opportunity. And there's just so much now that I think the public is learning that pharmacists can do that isn't traditionally what we thought of.
Yeah. So let's talk about this. What are some services that a pharmacist... Oh, we're already having audio issues. So sorry. I have audio issues always. What is some of the services that you think that people might not know of? And I can think of a few, so maybe I can snowball some and then you can say, yeah. So for women, if you are struggling with a UTI and you are having wait times at clinics right now, I feel like you can't even get in. You're really going to emerge to be seen. So if I was a woman who was struggling or a man with a UTI, you can help with that.
Absolutely, yeah. I know there's a shortage of walk-in clinics out there. We have a couple urgent care clinics, but the wait there even can be quite long. And let's face it, quite often, even at those places, there certain things, certain more serious things are really what the public would be best served by in order to see doctors and nurse practitioners at these clinics. So pharmacists can do more, as you mentioned, Alexa, and UTIs are a great example of that. Now, a pharmacist can't just prescribe for a UTI willy-nilly for any situation. You have to think of the pharmacy when a pharmacist is prescribing as just being like going to a walk-in clinic. You're going to go in, you might wait a few minutes and then sit down with the pharmacist, and the pharmacist is going to do an assessment. Same as a doctor or a nurse practitioner at a walk-in clinic would do. Yeah. So the pharmacist is going to ask some questions to ensure that it fits our scope, fits our knowledge and our expertise, and that we can or can't prescribe for you. But in the majority of cases, for this example, what we call an uncomplicated UTI, where someone is just in the early stages, a pharmacist can take care of it. Yeah. Now, the reason why our scope has expanded like this is because the government has realized that resources of doctors and nurse practitioners and hospitals shouldn't be used for these simple things. And these are situations where it doesn't have to be physical assessment, lab monitoring, things like that done. And pharmacists have the knowledge and expertise to do. So your example is a perfect one, and I certainly can.
Wish I was around when I was younger. But it's good to know, and females or men struggling with it, because if you've ever had one, it is so painful, and it is so hard to sit there, even and wait for hours to be seen. So if you can streamline that a bit and get it taken care of before it going actually worse, and you start to bleed and all that kind of fun stuff.
Yeah, the things that people don't want it to progress to that stage, of course. And so I think that's what people need to think of, or can think of, as your pharmacist, your pharmacy, as a little bit more of a walk-in clinic, a little bit more of your first point for care, not just pills in a bottle, slap a label on, here you go, basic instructions. And I think that's what we can talk about today.
Yeah, if we can dive into that a little bit more, can we maybe throw out some other examples or services that you might like? So, I mean, I feel like I'm a female, so I could ask lots of female questions, but is there stuff that you see like in men that you might not think of, like walk-in clinic? I mean, you can get like Plan B at the pharmacist. Kids, like, do you guys see kids?
Sometimes, yeah, for select things. So I'll list some of they call it 21 minor ailments plus contraceptive prescribing that pharmacists can prescribe. And it is actually, you can Google pharmacist prescribing BC and you'll find it on the government website. But we talk about kids, eye infections. I mean, anyone who's got young kids, probably at some point your child has had a pink eye infection. And there are over-the-counter remedies that can certainly treat them, but also there's prescription remedies that can treat them. So the benefit to that is either you're getting something better, or maybe you have extended medical and you want to get your prescriptions covered. And in these situations, a pharmacist is a true prescriber, just like a doctor. So if you have extended medical, you can come to us. We can prescribe something for that, again, after an assessment to make sure it's appropriate. But so that's just one example. Impetigo is another. If people don't know what it is, very common bacterial infection, very minor thing that we'll see on kids, adults too, but kids quite common. Acne is something pharmacists can prescribe for. I mean, going back to women, menstrual pain, we can prescribe certain things for menstrual pain. But I mean, headaches, hemorrhoids, allergies, many skin infections, fungal infections, if I didn't mention that. If we go to more commonly the older population, we can prescribe for shingles. Oh, wow. Which is a common thing. Anyone who's had chickenpox can get shingles. So yeah, many things that you might get, you wait to see your doctor, it might take a while to get in to see your doctor. Whereas it would be so much greater benefit to individuals to be able to get treatment and assessment right away, which is generally where we come in because pharmacists are there.
Why do you think there's like this lack of education around this? Because even me, you know, we all go through periods of suffering with, like, when did pharmacies change to be able to do these kind of things? I know you said recently, but like, could I book an appointment, or how does it work? Or you just walk in? Like, can you explain the process a little bit for us?
Absolutely. So it has been over a year now since pharmacists have been able to do this. But yeah, that seems like a long time, but it's really not. No. It's early. And I know there wasn't tons of awareness, tons of media rollout, because part of the concern also from the pharmacy industry was if we get absolutely, you know, a landslide of people coming in, the pharmacy industry is not going to be able to cope. And I think the government was sensitive to that, and so didn't want to have a really aggressive media campaign for this. So it's,
or like, you don't need to see a doctor, just go to your pharmacist.
So it's kind of quietly rolled out there, which is why I think the public doesn't necessarily know. The public is getting to know more. People are learning, often through pharmacist interaction. But as far as booking an appointment, there is, again, a standard government website. So the odd pharmacy might have their own booking platform, but you're doubling up when you're doing that. So if you Google it, easiest way to say is pharmacist prescribing BC. You'll see the ailments, you'll see there's a link on there on the provincial government site for booking. And so just like booking COVID vaccines or flu vaccine appointments, now you go on there, you put your postal code or geographical area, and it shows you what's available. So as long as a pharmacy has input appointment slots, you can book. That said, sometimes that's not practical, it's hard to navigate. And I can't speak for all pharmacies, but I know we always have sort of the staffing levels. We're very people-oriented and want people to know that we're there for them and that we have time for you. So you can come in with virtually no wait time anytime you come into our pharmacy, and we'll be available to take care of this for people.
Oh, I'm like, I live in Rutland. Why am I not coming to see you?
Good question. You should be.
I know. No, it's no excuse. I'm 2 years. When someone would ask me who my pharmacist is, I'm like, I don't know. I don't have one. I gotta switch that. Okay. ways that you guys can support people managing like chronic conditions like diabetes, high blood pressure, that kind of stuff?
Yeah, absolutely. Things like that too, or you could look at it as extra services that people don't think of. We're happy to check people's blood pressures if they need that when you're talking about blood pressure. For diabetes, we certainly can do consultations, and not even at the counter. Sometimes it seems like your typical pharmacist interaction is pretty quick, how to take it, take it with food or not, go home. But we're happy to sit down with people. We have a private consultation room where we can do more in-depth consultations regarding any medical condition, any drug therapy, whether it be diabetes, blood pressure. We can check in to see where your levels are at, if things are in proper range, and certainly make recommendations to try to improve your health outcomes. But again, it's not just diabetes or blood pressure, it's everything. And maybe not all pharmacies are equal. I can only speak for us, but I know we have the time and are very happy to spend the time to do these things for people, which goes into the medication review process. I think a lot of people don't know about that, and medication reviews have been done and actually set up by the government for years.
Oh, wow.
And it's billable. It's something that the government recognizes the value of the pharmacist's time. And so if a person is on a complex medication regimen, we can actually bill the government for the medication review. And the assumption by the government is that hopefully we can make some positive recommendations and make some improvements. So it's not just, here's your meds, bill the government. There's not a return for your tax money on that. The idea is supposed to be that there's a return because we're positively impacting people, and that's what we try to do.
Okay, that is so interesting to me. So let's say I go to my doctor, I get prescribed, a prescription or something. I come to you guys, I get it filled out, and then you're telling me that you'll give me the medication, but then if instead of going back to my doctor maybe in 2 weeks, let's say I was feeling bad or something was going on, I could come review things about the medication with you?
Absolutely. And we try to talk to people about that. Sometimes, especially if you're sick and you just got a prescription and the pharmacist is talking to you about a whole bunch of things, you don't necessarily understand what a medication review is, you're going to go home, and it's understandable. But so think of your pharmacist really as a member of your healthcare team, not just for dispensing medications and telling you about it. Someone you can come to if you need advice on anything, if you need your health and your medication reviewed, whether it be drugs, vitamins, natural foods products, nutrition, overall health. Pharmacists actually don't have as much training in physiology and anatomy and assessment as a doctor, but have a fair bit, more than people think. And an add-on to that now actually is recently we got authority by the government to order labs. So when you talk about monitoring, there's a few we can't, but when you talk about monitoring, say someone's on a thyroid medication, a pharmacist can actually ensure that you've had the proper blood test monitoring done. Diabetes would be another one. There's lots of monitoring that's done. So a pharmacist can ensure you've got it and actually order it if you hadn't. So be even more involved in the ongoing monitoring of your healthcare needs.
Oh, I love that. I would never have guessed that. I don't think I'm the only one out there.
No, this is the newest thing that they've actually kind of rolled out for the pharmacy profession in BC.
So you touched a little bit about like vitamins and that kind of stuff. Can you elaborate a little bit more? So I'm sorry, I'm using me again. Example, I'm in my 30s, trying to get pregnant. I'm trying to find, the best vitamins to feel, great. My skin's changing, you're starting to age. Like, you're saying the pharmacy or at Rutland and other pharmacies can, if I was like, I don't know what vitamins I should be on, I have no idea. You guys are able to assist and kind of guide on what I should be taking.
Yeah. I mean, every pharmacist is going to be different in terms of what they're comfortable with, but those are things that most pharmacists would be able to help with. And I mean, there's some pharmacies have more products that aren't prescription related. We're pretty small. We don't have a lot of front store, but we can still help to make recommendations. Other pharmacies might specialize more in that. There are specialty pharmacies out there that specialize more in skincare, hormone replacement products and things like that, which again are avenues that you probably don't think of a pharmacy for, but there's definitely pharmacies out there that can really help with these sort of niche type things that people are looking for.
Very cool. Well, I'm just loving how you guys have a stigma. Pharmacists have a stigma. I hate to say it, but it's just like, oh, they just prescribe pills and like send you off. But it really seems like, at least at Rutland Medical Pharmacy, you guys care. Like you want people to feel better and find an answer, or, like live a better quality of life, it sounds like. And you're not just like, here's your medication, take it, go, like, see you next month. Like,
absolutely. I mean, my approach has always been, it's about the people. The people are your most valuable asset, and that's not just your team. Sometimes that sounds like, oh, it's all about your team. And absolutely, I wouldn't be there if it wasn't for my team. I wouldn't be here if it wasn't for my team back at the pharmacy making it possible. And they're amazing. But the customers that come into the pharmacy, we wouldn't be there if it wasn't for them. And so we're really thankful for all of them. And so we want to be there to try to improve your health and improve your health outcomes. And that doesn't mean prescribing more pills. I'm not in the business of just trying to get as many prescriptions out there, because in the long run, that doesn't make my community happy and healthy, and doesn't then make me successful. So there's a term called de-prescribing.
Okay.
And that's, again, when we look at all of your medication profile every time, it's something that we keep in mind, and especially when we do a medication review and are looking at things in even more detail. But de-prescribing refers to trying to either reduce your dose or reduce how many medications you take. And I've had people say that, oh, well, you wouldn't want that as a pharmacist. Absolutely, we want that. Because if you're healthier and if you're happier, you're doing better, your community is doing better, and you're probably happier with us. And so you're probably going to continue to come to us, which is good for me in the long run.
Yeah, no, for sure. And I love that. It's about making the greater good and like the impact, rather than, just, a pharmacy that could just say, no, I just want to prescribe pills and make a ton of money. Like it's very community. I love that. So let's talk about a little bit maybe that you guys might be able to support people. We talked about chronic pain, but is there stuff that pharmacists can help with, like mental health? You hear it more often. People are talking about it more often. Is there anything that you guys can help in like depression, anxiety, sleeping issues, that kind of area?
Yeah, there is some. That's something that we can't necessarily prescribe for in the way that I was talking about the minor ailments. But one thing that's really important for people who are being treated for any mental health condition is, if you're using medication for it, is consistently taking the medication and the right medication. Now, sometimes when someone starts out on a medication, it's a trial, and I mean, there can be a period where it takes time for your body to adjust, or there can be side effects, and we're an expert in that. So your pharmacists are there for you to talk to about that. Is the medication working well for you? The other part is, it's so important to not miss taking. And so there's a lot we can do around that. And there are cases where people run out of refills and they can't see their doctor, and then you end up getting stuck. And with mental health, you could really
it could
really go downhill if you're not taking the medication, assuming it's doing what you need. So pharmacists can also add on refills in most cases if you've been on the medication long term, or at least do an emergency supply to ensure that you have a supply of your medication. And again, pharmacist discretion. There are cases where a pharmacist might do an assessment that it doesn't make sense, but in general, that's something we're going to do because we're there for the safety of the individuals, the safety of the public in relation to their medication and their health care. And so that's something that we're there for, and the legislation allows us to do those things.
Very cool. I was thinking of a girlfriend when you were speaking that, like she's done that. I don't know, we're busy, you have to take your pills, but ADD medication. I noticed she's like freaking out because she's like, well, I need to update my prescription, but I can't get into my doctor. But I feel like you guys might be able to support in that way.
100%. Yeah. We do those things all the time.
Yeah.
And an adult is a great example. We often think of kids when we ADHD and the importance of the child having that medication to help them be successful at school. But adults certainly deal with those same and similar problems too. And so we're certainly there, and never, we would never feel like you're a bother. We always want you to come into our pharmacy, and we'll take care of those things if it's within our ability and our scope.
So maybe to wrap it up, we've kind of touched on it, but can we just maybe end with, like, my question was, why should someone turn to their pharmacist before going to a walk-in clinic in certain situations? It's kind of a broad question, but yeah, like, maybe wrap up, like, we want people to go to Emerge if they're gushing of, like, blood and,
of course,
you know, that kind of stuff. But maybe you can just, like, your best advice to someone where you're sitting there and you're like, oh, I really think I just could walk into the pharmacy and get them to assess me, and I don't need to sit in Emerge or a walk-in clinic, and I don't want you to have flooded gates suddenly after this. Everyone's coming to you next week and this week because they're like,
oh, we'd love it if everyone came to us. We'd find a way to make it work.
Rutland's like, oh my God, Alexa, people are calling me to see all these things. So yeah, maybe if you can just wrap up kind of.
Yeah, I mean, your statement is great. Of course, if someone has a serious wound or if you've got a serious deep cough, the pharmacy can't help with that. We'll be sympathetic and we'll tell you to go to the emergency probably. So there are many things that you should still see your doctor and you need to see your doctor or go to the hospital for. But for things that are a little bit more minor, your pharmacy, assuming that they have the ability and the time to help out, can probably see you right away. So I think that's the reason. And your pharmacist probably knows you if you've been going there for a long time. I mean, who in healthcare wouldn't prefer to have someone that knows them and knows your family and has talked to you many times? Most of us are much more comfortable talking to someone that you feel truly knows and understands you. And I know for me, in the way I've always practiced pharmacy, that's the way I try to be, and that's the way my whole team tries to be. And so, and I think most pharmacies are. So feel comfortable using your pharmacy in those situations. And I guess worst case scenario, you go to your pharmacy, which is probably only a few minutes away. You talk to them and they go, well, sorry, you are going to have to go to the doctor or Emerge. And so you probably haven't used up that much time in that situation, but you may have saved hours when you didn't have to wait in emergency or at a walk-in clinic.
Yeah, amazing. Well, I am excited. We're going to throw the list of things, just like you said, there's like 21 things that people don't really know, like the pink eye, UTIs, birth control sometimes, that kind of stuff that you can go to your pharmacy. I think it's very cool that you guys are finally getting that power. You do go to school for a very long time, don't you?
It takes a little while. Yeah, it does take a little while.
But I love the community approach and having someone in your corner. I mean, I don't know why I'm not seeing Steven. But I think it's also, health is, sometimes you're feeling alone, like having health issues or embarrassment or that kind of stuff. And it sounds like really cool that you guys are just trying to be there as, like, what did you say, your team? That, the team that's going to make sure that you're doing what's best for you and taking care of your kids, or because we need our health.
Of course we do. Yeah, it impacts everything in our lives. It impacts how we show up at work, how we show up for our family. And I mean, the one thing, and I don't mean to go back to a specific topic, but I think the other thing that people need really timely care for is shingles. If you're worried that you have shingles, your pharmacist can probably look at it and tell you, and if it is that, get you treatment right away. Whereas if it's not treated right away, you can get long-term nerve pain that can be horrible. And most people probably know someone that has had shingles. And so we've had many cases where we've seen someone and here's the medication and they get it right away. But I'll go back to you there to wrap up, I'm sure.
Yeah, so did I miss anything? I think we covered a good chunk. I mean, I'm sure there's more, but Steven and his team are amazing. You heard it from them. They don't want to just prescribe you medication. They actually want to take the time to listen to you, and they want us, Kelowna and the world, I would say, just to be healthy and happy. So
absolutely,
let's leave it at that, healthy and happy. So thank you so much, Steven, for all the amazing things you do in our community. And stay tuned, because we'll have another episode. We're not sure the topic, but if you have any recommendations, send them our way.
Absolutely, that would be wonderful. I look forward to it.
Awesome, thanks.